The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of things. The medical industry as a whole, and in particular, I think Big Pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. Hey everybody, welcome to this week's episode of the Zero Downside podcast. You'll see once again I've been abandoned to discuss science literature. So anytime we go through the science of something, everyone kind of runs out of the room like the Home Alone kid. And I get it, because the science part of this and me just illuminating what's already been published, I'm not taking the stand and saying that this cures certain things. I am saying what's been published and what's been studied is fairly dramatic, and it's been out there for a long time. Today's subject is way more controversial than anything that we normally address in the U.S. outside of high-dose IV vitamin C, which I'm still shocked at how controversial that content is, when all I did is read from publications that are published in the U.S. and are available readily on PubMed, and most of those even on Google Scholar. So hopefully you were able to do a little bit of your own due diligence on some of the topics we've covered and came away, well, I'll tell you how I come away from it usually. I get more than mildly frustrated at why this type of information that could be really helpful if I was sick and looking for help has been so suppressed and hard to get to. So what I'm hoping is if I just kind of point people in the right directions, because you should be able to expect your physician or anyone involved in your healthcare with you, they should be able to be held to a certain bar of knowing what's been published. If you're going to trust them as your only source of information, then they should have access and be willing to do the deep dive to help you make those decisions. Now, here's the problem with that. Most physicians are employees now of the healthcare system, and the healthcare system is only interested in providing care that has a code, a diagnosis code, a treatment code, a reimbursement code. Those codes are what are going to drive not only your diagnosis, but your prescribed plan of care, and most disheartening, the limits put on what your plan of care could include. I think that my goal is to show you what's in the literature from a point of view of a physician that should at least know how to take some of the experimental literature, some of the science, and package it in ways that you may be able to see the applicability to the way you feel, your standard of care that you've set for yourself, your current chronic disease state, your metabolic state. My goal is to help you navigate the waters through the medical literature and to give you a little bit of an understanding over what's possible and what's already been done, why it makes sense, and some of the science behind it. As you go through some of this, and we have a lot of patients that our patients come pretty well read sometimes, and certainly they've had to leave the auspices of Western medicine to seek our care out. And when a patient goes through all that, my goal is to make sure that they know they're in the right place, and that I kind of help them navigate the waters of, because even when you read the science literature and understand it, there's a lot of legality involved in putting together a plan of care that involves science outside of what would be considered traditional Western medicine. Even with bone marrow aspirate concentrate in general orthopedics and for osteoarthrosis and for wear and tear and for spinal fusion and for interdiscal and for rotator cuff, for tendinopathy, for chronic regenerative changes in the Achilles, all these are already published. And it's still controversial. And most of these papers go back 20 years. Certainly, bone marrow aspirate concentrate has been readily available in the US. Easy kit designed by us to help in the harvest of that bone marrow in a very minimally invasive way that takes 3 to 5 minutes, leaves one hole in the iliac crest, and it's one stitch. So those questions have already been answered. And we continue to kind of fight the narrative against that because there's not a reimbursement code, because it takes a few extra minutes, because the hospitals don't like not getting paid for part of a procedure, even though they get paid for the whole procedure, because we are able to work that part into your procedure because it changes your results, it lowers your risk of infection. Again, not my opinion. That's what's published in all these papers. I think that I still don't understand that resistance to that. What we're going to talk about today is something that if you don't understand the resistance to that, you're going to have real trouble understanding why those cells, autologous from you, just culturing them down and forming a better graft than using raw marrow and being able to concentrate that. If there's great publications, a lot of studies, and a lot of data that already exists on treating your chronic and orthopedic injuries and your overall sepsis, right? A lot of medical conditions that there's really not great treatments for within Western medicine, there may be great treatment for outside of traditional Western medicine. I don't know why we have to talk about Western medicine in so many anti-scientific terms. The science behind the biologics and the efficacy with which biologic agents can absolutely aid the body in not only healing from chronic conditions that it's not recovering from very well on its own, but to also help the body function better than it has in years because the chronicity with people's overall health and the age and their medical diabetes, every medicine you've ever taken, every Tylenol you've ever taken, every fall you've ever had has left a mark. And those metabolic marks, that life score of injury that you kind of carry with you, these are the cells that could help restore overall function and health to chronically diseased tissue. And I'm not postulating that. I'm going by what's published in the literature because every time I do a deep dive, and this time it wasn't even about finding some treatments that I didn't know existed. We found some diseases I'd never even heard described in these terms. You know, post-transplant atherosclerotic disease for organ transplants. The atherosclerotic disease, meaning the scarring into the vessels that someone goes through, not even just rejecting an organ, but even if they don't reject the organ, the healing and the difficulty that someone has establishing healthy blood flow to that organ and it staying healthy. Atherosclerotic changes mean vessels just don't work as well as they should. Post-transplant atherosclerotic disease is really, really common, like everyone that has a transplant. And there's some great literature that's been published for decades on the treatment of those patients with high-dose cellular volume from undifferentiated umbilical cord tissue and the dramatic differences in vascular injury, perfusion, overall organ health, survivability of organs through sepsis, the clinical care aspects of the use of high-dose cells. This isn't theoretical. The theory of these cells and their growth factor secretions has been around for decades. The actual clinical science has existed for more than 20 years on a lot of this. The the use of cultured umbilical cord tissue in neurodegenerative diseases, MS. If you go to Google Scholar or PubMed and you Google umbilical cord stem cells for the treatment of MS, you're going to find, not on Google, Bing, or Yahoo, Google Scholar or PubMed or DuckDuckGo or Brave. What you're going to find is there are review papers that list thousands of patients in their trials, but there's actually been good level 2 data on clinical trials in MS, in post-stroke patients. There's some great in vivo data in the animal models where they induced the strokes with complete occlusion to vessels, and with cultured umbilical cells reversed the atherosclerotic and the stroke edema in the brains in vivo. There's good clinical data on stroke patients and their overall recovery being augmented from the neurodegenerative diseases, recovering areas of the brain that may not have recovered as fast, and restore brain health, post-traumatic brain injury, Alzheimer's. It is shocking, and hopefully when you go to this search and you do a little due diligence, you're going to find out when people ask me, why are you going to all this work to deliver a graft that's not legal in the United States, and meaning that they think there's bad science behind it or it's really experimental, right? That's just not true. It's just not going to be approved in the U.S. This is not some far-reaching planetary, oh my God, that's like, it's like Elon wanting to settle Mars. This is not that far out. This is stuff that's already been done. It's already been published. It's been postulated how this would work. The physiologic science behind these growth factors and their modification of these tissues and the diseases has already been published. We're not stepping out on some unstable island of experimental new treatment where people say, oh, well, if you need anyone to experiment on, we don't need guinea pigs. This science is way past that. And the efficacy and safety of culturally expanded, ethically sourced postnatal tissue graft is widely documented and really easy to verify. Now, here's where the problem comes in. Talking about apples to apples. And you'll see all kinds of different descriptions of the way these cells, even in literature that's written by scientists and physicians, still describing some postnatal or umbilical cord cells or Wharton's jelly tissue or perinatal tissue graft from the amnion. There's even some descriptions of that as embryonic tissue. It is not embryonic tissue. Embryonic tissue comes from an embryo. That is a life from cells from mommy, cells from daddy that join together and make a baby. That is what an embryo is. At a certain point, that becomes a fetus. And fetal tissue graft has never been used and would never be a useful graft in what we're trying to talk about it for. Fetal tissue graft, the only one that uses fetal tissue graft are big pharma and cosmetic companies. Medicines never use that. When they came out and said they're killing babies with stem cell science for medicine, that was never true. They got ahead of the narrative. They threw just enough shade on it to make the next 20 years about trying to respond to that instead of about kicking the ball further in the effort to help patients. Fetal tissue graft is trying to become a fetus. Umbilical cord cells are always going to stay an umbilical cord cells. They're neither maternal nor fetal. There is maternal and fetal representations within the umbilical cord, but the umbilical cord is an organ. And that tissue is responsible for protecting mommy and giving the baby, the fetal tissue, the opportunity to develop into a baby that can sustain life on their own. The umbilical cord is responsible for a lot of the growth factors, the regulatory, the hormone secretion, the hormone regulatory status to guide the way to where a host can have a parasite that becomes healthier than the host without killing the host. So no one's going to describe a child as a parasite, but you can laugh at that if you want, because I raised 3 daughters too. But I will tell you that meaning in nature, if there's a host-parasite relationship, meaning the parasite meaning that everything that sustains life for that organism comes from the person they're attached to or that host tissue. There's not a lot of instances in nature where that's possible without it killing the host or limiting the ability of the offspring to become bigger and better. In nature, especially mammalians, because of the umbilical cord, that tissue, which I think is uniquely capable of sustaining, propagating, and providing overall health and wellness in an undifferentiated expression of the genetics of those cells. Those cells are extremely unique. And being able to isolate those cells, number them, come up with what type of cells you're looking at, and then using that tissue graft to help someone heal, this should not be controversial. If you believe in organ transplant, and as a surgeon, I think that organ transplant is one of the best uses of modern science. I think the fact that you can save some, I have a friend recently who's a physician who was diagnosed with Goodpasture's disease and was dying and very, very quickly and just got a kidney transplant. He's a year out. He looks great. I really admire him and his wife. They've been together forever. They have a great family. But what they navigated through, a buddy that he served in the special services with donated a kidney. I think that that's remarkable, and I'm glad that I have a friend that has been able to live because of organ transplant. Now, that being said, if you're a fan of Western medicine, if you're a fan of science, if you're a fan of organ transplant surgery, for someone to donate kidney, you need to really love the person you're donating a kidney to. If you're going to donate a heart, you can't even do that. Your family's going to do that if you're the one that passed away. So eyes, heart, kidneys, liver, the donation and securing of that graft is crucial to helping someone that is in a chronically ill or dying stage of life, especially if they're hooked to a machine and you're going to unplug it. You're going to be talked to by an organ donation coordinator, hopefully. And you're going to be able to take those organs and sustain the life of other people with your donation from your family member. And I think that could be really important. But does any of that discussion need to be had if you have a C-section with your umbilical cord? It's not affecting your overall health to donate that cord. It's going to be thrown away otherwise. So if you're saying that organ transplant surgery is important, and I think that that's a very valid point of view, then why in the world would we throw away an organ that's capable of much more than just making up for something that's chronic and diseased? Have stem cells from umbilical cord tissue been used to bring the liver back to life in chronic post-herpetic cirrhosis, chronic liver failure, venous congestion with liver failure? Yeah, it has. And those publications exist out there. What about chronic kidney disease? Are there any uses of culturally expanded umbilical cord postnatal tissue graft been used to bring the kidneys, dead or dying, back to life? Yep, chronic renal failure. What about post-organ transplant and the secondary atherosclerotic? Yep, been published. What about sepsis? In the clinical care literature, sepsis is better one. Graft versus host disease. Graft versus host disease has a 50% mortality rate. What's the mortality rate when treated with high-dose culturally expanded cells? Even with bone marrow culturally expanded, the mortality dropped to 0. 100% of the patients treated with that in several of these studies lived, and only 50% would have lived without use of IV cells. So you're taking a disease and changing the mortality to 0. and a disease that has a mortality of 50%. I think that should be a very important discussion if you have graft-versus-host disease, which is you taking someone's marrow because you have a blood disorder or blood cancer, and when you get other bone marrow donor blood, if it's not really perfect for you, you can have graft-versus-host disease. And graft-versus-host disease is about 3% of regular, doing everything we can to match it. But it's about 20% if we're just trying to get close. And that 20% graft-versus-host disease with a 50% mortality rate is tragic. The only reason those people are even put in that position is because there wasn't anything else available and they had to take the chance because they were sick. But you could take culturally expanded postnatal tissue graft and prevent the graft-versus-host disease by pre-treating that, where you can use much less specific donor and still lower the risk of graft-versus-host disease. Post-stroke, I think that is post-traumatic brain injury. Great papers out there published. Myocarditis, there's actually even to the point where in the heart failure data, there are some great rat studies that go back a long time. And remember we talked about in vitro and in vivo? Well, animal studies are still in vivo, but they're not human study. But I think if there's no in vitro reason for why the cells would make heart failure go away, there would have been no in vivo study. So vitro's the lab. So we prove that, wow, if you have a cell that could secrete these peptides, prohormones, myokines, cytokines, those seem to be reflected in the lab that they would alter the long-term effects of heart failure or heart disease or myocardial ischemia or cardiomyopathy. I mean, anything that makes the heart not work great. We know that these secretions of these cells should help it work better. That was in vitro data. In vivo is taking an animal study, taking these culturally expanded cells, and then changing the animal study and the heart failure. And it's down to the point now where we know, or they've isolated what they think is the one big peptide secreted in that can make a difference in the heart failure part of this. And obviously they're trying to make that into a drug. But for us, the chronic inflammatory load provided by the human body that's failing and its inability to control its own inflammatory load, that's the best use of culturally expanded cells from the umbilical cord tissue. What would that include? Well, pretty much anything that someone has that's making them sick, whether it's chronic environmental toxins and exposure. The mark it leaves on your tissue and your tissue's inability to maintain normal perfusion, blood supply, to wash out its own inflammatory load, to keep the overall health pathway. Those organs are usually have more than just the the kidney doesn't just clean off some. It also supplies the support for adrenal support. So there's a lot, water regulate. There's a lot of other functions that these cells support in someone that's metabolically damaged. And we don't have to isolate the cell down to each individual illness that you have. If I try to make it to where you are a better version of you, it's amazing what you may be able to conquer and recover from as far as some of the marks of life left on you. Hopefully, if you watched any of one of our recent episodes where we talked about, I had the book out from James Clear, Atomic Habits. And the reason I brought that book out is because I thought there was a story in it that, and I'm using for not necessarily why they told the story, but the story was about a guy that added hand washing and soap to the daily lives of people in Pakistan and Karachi back in the 80s. And just by doing that, they changed the rate of endemic diarrhea by over 50%. The dermatologic manifestations of all kinds of infections by more than 50%. Changed childhood survival rates dramatically. All he did is introduce hand washing and soap because people knew it was important to wash hands, but most of the time they'd wash one hand or they wouldn't wash them all the time. So did soap cure diarrhea? No. Did soap cure the dermatologic problems on your skin? No. What did it do? It gave your body a fighting chance, because your body has all the mechanisms in place to defeat those. If you debulk it a little bit, like don't make them fight the biggest, baddest kid in the class all the time. And that's what soap does. Soap helped change the environmental toxins working against someone in those situations so that their body was able to do a lot of the work on its own. That's the way, and that's the reason I made that analogy, is that's the way cell therapy works. Is it going to cure something? No, it doesn't have to. Your body has most of the mechanisms in place that it could cure that, because it doesn't even have to have those diseases. Not everyone has that disease, but someone's metabolically challenged, someone had an inflammatory overload, you had an injury, something unique about your history put you at risk of that. Your body's not hitting on all cylinders. The way I think about the access to umbilical cord tissue graft is it's going to help your body operate at a higher level. It's like upgrading the octane in your gas. It's like having a tune-up. It's like using a better, nothing makes me as mad as to clean something and it not be clean because you're using the wrong product to clean it. That's kind of what the body does in chronic stages of disease and illness, is it wants to clean it up, but it lacks the right product to do it with, right? Do you use the same stuff on your floor as you use on your wood? No, because the wood looks crummy or the floor looks bad. The body needs the ability to differentiate those products to be able to handle the contamination of daily life too. If we want to clean it up, right? So the analogy of cleaning something, that's what the body's trying to do when you get rid of disease. It's trying to return to a normal state of not diseased, not altered, not chronically limited in its ability to respond. So how would you do that? Well, it would need access to a lot of tissue proteins and secretory enzymes, prohormones, myokines, cytokines, growth factors, maybe even just messenger RNA and the mitochondria of the cells, because it's really well published that these postnatal tissue graft cells are able to expel their own mitochondria into the diseased tissue that lacks the mitochondrial efficiency to function like it's supposed to. So it may be as easy as they're coming and if you're flying a long mission and you're in a plane that doesn't want to land, one of the things that extended military capability all over the world is being able to refuel a plane in flight. The body needs the ability to refuel the plane while you're still accomplishing life, right? Like, you shouldn't have to take this huge break from life to recover and heal up from everything. We need to be able to administer that treatment to your tissue in the way it wants to see it, not with some drug it's never seen, but within the tissue proteins, the myokines, the cytokines, the prohormones, the ligands, all the different things, sometimes just the mitochondrial contribution, that these cells could give your body a chance at fighting back with rheumatoid arthritis, with MS, with autism. Look, the autism data there's a lot of studies that are if you've never even heard this said out loud, and you start looking at high-dose culturally expanded umbilical cord tissue or even just autologous expanded cells in the treatment of autism, fat stem cell digested from fat, bone marrow, let alone umbilical cord cells. When you start looking at the use of these cells in high doses and the effect it's had in any disease considered autoimmune, in any disease considered inflammatory, it's going to be shocking, because guess what these cells do? A stem cell can only do three things. One of them is it's the most potent secretion of all the anti-inflammatory peptides, proteins, enzymes that you can generate. Number two is it secretes all the regenerative peptides, proteins, so you can actually help regenerate tissue. Number three is as B-cell and T-cell mediation on the autoimmune system. That's the use that we're not even allowed to talk about in the U.S., because the only way to do that would be to give you culturally expanded cells from an umbilical cord IV. Now, so I just learned a few weeks ago that the podcast has a drinking game attached to it when we say, anytime I say downside or zero downside or limited downside or completely safe or but what does the literature look like on taking those cells and giving them to people? Well, they're immune privileged. So there's no real incidence of secondary rejection. Actually, in the rejection literature on organ transplant, the use of culturally expanded stem cells reduced the rejection, increased the incorporation, decreased the secondary arthrosclerotic disease, and decreased the secondary overall organ failure. That's really well published in a lot of studies. There are big review articles that have thousands of patients in them that's what the literature would indicate. Oh, the safety data on these cells has been really well published for 20 years. Now, would I want to get cells from an umbilical cord in a patient that was contaminated with spike proteins or had genetic predispositions to cancer? No. So how do you avoid that? Well, you genetic test all your tissue. So let's say it together, because we say this in every episode, is healthy mommy, healthy baby, healthy cord, all genetic tested to make sure not only for the viability of the tissue, but for the genetic purity and lack of pre-existing disease or the possibility of genetic transposition to disease. This tissue doesn't even have the cancer for gene someday, right? So, and because it's postnatal tissue graft, there's no antigenic component. So you can't have an allergic reaction because it's immune privileged tissue if it's prepared correctly. And that's the tissue we're talking about. And those discussions are extremely difficult to have because even in the medical literature published by doctors, there's a lot of confusion because that doesn't legally exist in the US. And so when you talk about culturally expanded cells from Wharton's jelly or from morselized areas of the cord or the amount of cells present in 1 cubic centimeter of a cord and trying to standardize that based on the health and viability, like there's not even a lot of good data, and I thought I would find a lot of good data that shows the overall metabolic health could be really associated with how healthy the cord is. That's not really true, it even looks like. Some of the more unhealthy moms still had amazingly healthy umbilical cord tissue. That is quantitative. It's published. Now, do we do genetic testing on all of those cords before there's cultural expansion of those cells? Yes, because it can be done. That's one of the things that's changed the most in the use of allograft tissue, meaning from someone else, is there's a way to sterilize it without killing it. There's a way to prove it's non-disease without altering it because you can genetic screen it now. That process used to take months and be hundreds of thousands of dollars. Now it takes almost no time, and it's become relatively inexpensive when you think of the repercussions of not having that testing done. So from our standpoint, if it's about me being your guide on the scientific exploration of what's possible with culturally expanded umbilical cord tissue graft, our goal is going to be able to kind of take you down a view of the literature on all these different individual subjects. This is kind of an overview of what's possible. I think the list of diseases is pretty all-encompassing, actually. A lot of diseases that I never even thought about as diseases. I know the sepsis literature has been great because that's all been generated in the last few years because someone got stuck with a lot of really sick patients in critical care, and critical care is tied into the overall political employment situation of a lot of physicians, and so critical care was entitled with, man, we just need options. And with sepsis, this looks like a very viable option. When that'll be available in the U.S. that's not under a drug format, I don't know. But in clinical studies, it's been really, really significant in changing the not only the mortality of the disease, but the secondary organ failure, and especially in limb ischemia from peripheral vascular diseases, diabetic neuropathy, retinal diseases, all that tissue graft. If you think of all the places in my body that are injured from chronic inflammatory load or chronic disease or post just a mechanical injury, this is the tissue that secretes the things that your body needs to help it do the job of healing, which is what your body wants to do. The human body was created to heal, and it does until it's diseased or overcome by it doesn't have enough resources to fight the battle on the front that it's being attacked. And those resources that your body needs to fight the battle on the front it's being attacked can come with some lifestyle changes, some hormonal support, some peptide therapy, some nutritional health. Oh, and what is the hack that would help provide all of that? And that's what we don't have available in the U.S., but it is available in the world now, and it's going to be available and is available in the Caribbean. And the reason it's available in the Caribbean is because the law was modified to make it available in the Caribbean because of myocarditis and inflammatory heart disease, and they're seeking an option for those patients, and this being the most well-published, least invasive, most efficacious treatment available. They're not looking for the most technologically expensive, really high complication rate, some significant little bypass or a little pacer or something you have to do to overcome it. They're looking for a way, is there a way to help these people's body overcome the insult from the inflammatory load, recover, and be healthy again? And it's way less complicated than we make it if you have the access to the right tissue graft and the right cellular volume prepared and administered in the right way to make it efficacious and specific to what's going on with you. If it's just overall wellness, that's much easier to obtain, but there's not as good a marker for me. Like I like markers for disease that I can watch the body recover from. Do we have to have that for you to be treated in the Caribbean? No. Do I think that the use of IV cells has been crucial in overcoming metabolically who I was 2 years ago? Absolutely. Has it made a difference in the chronic organ function measurable on lab values? Absolutely. Is there some changes in people's overall creatinine, their BUN, their liver, kidney function, their inflammatory load, their C-reactive proteins, their functional scores? We talk about using Elevate as an app to measure functional scores after IV cell therapy all the time. It's a great app because within 2 or 3 treatments on that app, you have your baseline. And even a college degree isn't going to change that by 20%. But it's not uncommon for people's Elevate app to change by more than 20% with the use of culturally expanded umbilical cord tissue to overcome significant cerebral injury, post-stroke injury, or post-traumatic brain injury. And that's been administered as easily as with eye drops, all the way up to nasal administered cells, all the way to IV cells, because the tissue proteins that help the inflammation don't even have to cross the blood-brain barrier to be effective. Is there ways to get them to cross the blood-brain barrier that are effective? Yes. Is there ways to do that with eye drops and nasal sprays? Yes, with morselized tissue that way. But is that necessary for the body to see some of these peptides and proteins and help lower your inflammatory load and see a difference in mental acuity, in that post-COVID fog, organic brain syndrome, post-stroke, Alzheimer's, depending on what really is your Alzheimer's coming from, because a lot of times it's some organic brain disease or a lot of countries, type 3 diabetes. So what about diabetes? Is there evidence to show it makes a difference in those patients? Yes, because it supports the growth and support of islet cells. That's really well published. Guess what cell that if you have, you probably don't have as bad a diabetes? Islet cells in the pancreas, pancreatic support, organ support. Again, if you're thinking, wow, this cell seems like, here's the problem with the business model. If it seems like this cell is the cell that could help overcome the structure and functional deficits that come with injuries and diseases, then you're right, because that's what it was created for. Right? I'll never forget that moment when I'm wondering, like, how do these cells know Like with the umbilical cord tissue, their secretory power is so significant and it's so diverse, and they don't secrete the same thing at every point of every month, and they're so unique to what makes it do that? It was created to do that, is the answer, because that's the umbilical cord's job, is support and function to support homologous growth and of a person to becoming a bigger person and healthy, and to protect mom from the fact that her calcium stores are being robbed, that hormonally she's having to support something, that she's literally having to gain all this extra weight, maintain all this mass. What are the cells that help support the health of mom and support the growth of a child? It's umbilical cord tissue. And that tissue was created to do that. Those same peptides, proteins, nutrients, hormones, prohormones, ligands, all the secretory power of that cord, the mitochondrial support, is all about how you would avoid disease, how you would avoid chronic injury, how you would recover from insults and injuries, from life, from environmental sources, from stress, from cortisol, from your own injuries. If it does that, then the business model is more about helping people be healthy, not treating individual diseases. And that's our goal. So our goal as a clinic in the Caribbean is going to be to help people obtain better states of health through the use of postnatal culturally expanded tissue graft with high-dose stem cells IV in a very proprietary manner to help give you the best possible result as possible. We're going to set the bar for your body at whatever that goal is that helps you feel the way you need to feel and overcome whatever struggle you're going through from a health perspective. And I think that with the right graft, which I feel very passionate about that being available right now, with the right regulatory status, which I think we've worked really hard on, and the government that has brought us into their country has been really, really supportive in making sure that this happens. With the right science backing behind us, I feel very comfortable with the PhDs involved in this project, with the right physician to help make these diagnoses, to help administer this treatment, with the right nursing care. We've put together this team, and it has all come about in an unbelievably relatively short period of time, because the regulatory piece is the thing we'd never really even thought about when we put this together, because even all the other countries that would allow us to use culturally expanded tissue still don't have the carve-outs to allow the optimization or agitation of those cells to higher levels of homologous performance. Meaning, a cell's homologous performance is what does it do in nature? Well, an umbilical cord cell does what in nature? We just talked about it. It's a very unique organ. It supports the growth and overall health of two organisms attached on either side of it. So we wanted to continue to be able to do that for someone not necessarily attached to that umbilical cord tissue, but being able to have access to those same cellular properties and secretions of that tissue graft. And I'm hoping to make that make sense. One of my favorite Einstein quotes was that if you can't explain it to a fifth grader, you don't understand it. And so I think that when you think of the umbilical cord as created to protect and propagate life and support the progeny of two people or two other animals put together, that umbilical cord is what does the actual maintenance and support. It's like if you don't water your yard, it's not going to make it through a Texas summer. The umbilical cord is not just the water, it's the fertilizer, it's the nitrogen in the soil, it's everything you need, because it's the only place your baby's going to get it. And that tissue graft, when it's not being told what to do by the baby and the mommy attached to it, is capable of secreting all of this in reaction to what the host is going through. You don't have to be attached to it for it to be a sensory organ and know what's going on in the environment and to be able to target the disease cells, the disease processes in a human being, and to be able to augment the ability for your body to help get over that injury. Hopefully, I've said this specifically enough to keep this episode up. I hope that you're able to cross-reference a little bit of what we've talked about before with the episode that we introduced, the BVI clinic, and kind of the thought process that went behind that. Even if this is a follow-up to an email you got from us, where we're just trying to give you enough information because you have an inquiry about coming to the BVIs as a patient, and you're clicking on this episode to get a little bit more information, hopefully that's happened. So hopefully you're subscribed to our channel. Hopefully you like this episode, and hopefully you can comment and ask any questions you have that we can kind of get a specific answer either to you through some of our staff that could contact you, or something we try to make sure I say in one of the next episodes to address any of your concerns. Anyway, hopefully you've got the information that I've been trying to simplify for you. When you go through some of this literature, it's incredibly complicated because they include all the pathways and the enzymes and everything, but it's not complicated in what it's doing. How it does it is pretty complicated, but you don't need to know the exact pathway to have access to tissue. Actually, the science behind a lot of what's published in these papers is wrong on how it did it, because some of it's 20 years old. It didn't even understand. There wasn't a great way to differentiate even the cell counts or some of these cell surface markers back then. Now there is. So the science has kind of caught up to it. But what they already had is the intuitive understanding that these growth factors made a difference in those diseases. How it does it is becoming better and better understood as we move forward. But whether it did it or not is not as controversial as you've been led to think. And I think that when you go through the literature on that, and if you take this pathway with us, where I'm going to make this literature available to you, I think that we're going to be able to help you come up with some really unique solutions for some problems that it feels like are pretty overwhelming. And it doesn't have to be. So I want to thank you for your time. I understand this is complicated, and I understand it's something you probably haven't heard, because everyone thinks that you're killing babies if you're using stem cells from tissue. And the umbilical cord is not killing anything. It's throwing something away that could have been incredibly useful to the maintenance of health, and there's just no reason to do that when there is an ethical, safe, efficient way to make that tissue uniquely capable of helping you overcome health challenges. And I think I'm very passionate about that. I've seen it in my own life. I've seen it in my sister's life. I've seen it in hundreds of patients' lives. And I think that it's really important that this narrative changes. The fact that it's being done in the Caribbean is not mean it's third world. Actually, this location is beautiful, and the science behind the graft is manufactured in the U.S. So I don't know exactly what the slings and arrows that they're going to have to toss at this to make it seem like it's quackery or unscientific or not beneficial. But I know they will have plenty of things to say. But I think there's a lot of great ways to debunk all of the myths that they come up with against how nature is so miraculous at being able to provide opportunities to get over certain diseases and conditions of not being healthy. So I'm genuinely looking forward to this discussion. Hopefully I can open your eyes to what's published out there, and still be able to keep my license, because I'm not going to postulate on the way it works or who it works on. I'm going to go by what's published in the literature and what we have clinical experience with, and give you the resources to fight back in your own little battle for health. Be your own advocate is really important. Hopefully you've recruited some advocates with you, because I think it's incredibly important you have someone going on this journey with you. I know we're ready to sign up to help you with that, and we'll give you the education and resources and access to healing that you need. Thank you so much for your trust. Again, if you made it to this point in the episode especially, please hit like and subscribe, and maybe even notify when the next episode comes up. And we look forward to seeing you next week. Thank you.